Hello, welcome everybody. We are
Hi.
so excited. Yep. Let you go, Lauren.
Oh, sure. I was just going to say, we'll spend our first few minutes just gathering as people join. We have hundreds and hundreds of you signed up, so we're really excited to see all of you. I'm Lauren Brody, one of the co-founders of Chamber of Mothers. My esteemed colleague, Deshi. Deshi, say hi.
Hi, I'm Deshi Singh. I am a co-founder of Chamber of Mothers and also the chair of the board.
So good to see all of you. So, as you join, just put in the chat where you're from and who you care for. We would love to hear from you.
Yeah, absolutely. I'm gonna look at this chat. Please feel free to add your name. Anisha Patel from Arizona, mom of three boys. I'm a mom of three boys also, 9, 8, and 4. Miami, mom of two boys. Amazing Tampa, Florida, Illinois. Another three-boy
Recording
mom.
in progress.
Chicago.
So many three-boy moms. Pittsburgh,
Yes.
Steelers.
Portland, Oregon, DC area. Waltham, Massachusetts. Arlington, Virginia.
I'm from Atlanta.
Southern California. Alexandria, Virginia. Denver.
Amazing. So we're also going to put a couple of polls up, so we get a sense of who you are, and so you can all see who else here. First one is asking, what's your involvement been so far with Chamber of Mothers? Please choose all that apply. If you follow us on social, if you get the newsletter, you belong to a local chapter, if you're a donor, we would love to hear about it.
I see a which aspect of maternal health
Oh,
quiz that
that's the
popped
third
up.
question. You can answer them in whatever order you would like. So the other questions are what brings you here today? One of them is, and you can choose again all that apply, seeking community, seeking actions that I can take for mothers' rights, wishing I had a local chapter, or just curious. And then the third is actually, I think, the one you guys saw first, which is that our theme today is maternal health is an American right. So, which aspect of maternal health feels at this moment, and they're all urgent, but which feels most urgent to you personally? Maternal mental health, reproductive care, prenatal care, postpartum care, affordable health care, maternal mortality, or bias in care? We'd love to hear.
I love that. I see Columbus, Ohio, Los Angeles, Minneapolis, Minnesota, Santa Barbara.
All right, I think we're good. Erin, you ready to get started?
I am. Let's do it. Can everybody
Oh,
hear me okay?
yeah, you look great. Okay,
Okay.
I would love to introduce Chamber of Mothers extraordinary CEO. She's an attorney. She's a mom of three. She's living in a house she just moved into yesterday. The
Bear
person,
with me.
the person who started it all with a fed up and fired up group text one night that I was lucky to be a recipient of in the fall of 2021, my dear friend Erin Ehrenberg.
Thanks, Lauren. That gives me chills. It brings it all back. Hi, everybody. And you are the reason that Lauren and I and seven others of us were texting that night to come together and create this movement that's built by you and is about you. We are so glad that you're gathered here with us. I want to, as an FYI, we are recording and all registrants will get a link after. Our goals today and with all of the town halls are essentially to have a national Chamber of Mothers meeting. Let's come together. Let's be together. And we know that there are a lot of folks around the country who want a chapter, who want to run a chapter. I think we have hundreds of folks who are waiting to launch, and we want to do that always in a very supported way. And so before we can establish everywhere, we're in 43 places now. We said, hey, let's get together. Let's not wait. Let's do this virtually. So here we are. We also want to show you how local chapter advocacy impacts all mothers' health. We're focusing on maternal health today of our three pillars, which we'll get into in a minute. And we also want to take a community action. So at Chamber of Mothers, we're the opposite of all talk and no action. We talk about what we care about, and then we take action together in community. And today will be no exception. And we also, as always, want to make sure that you feel cared for and held. Look, we are all doing this work in the cracks of life. I just moved. Tomorrow's the last day of school. I'm sure everybody has a story about how it was so hard to get your butt in this seat or on the phone. And we so appreciate you being here and we want to make sure you're held. Who better to do that than Dr. Becky, someone who I turn to all the time. You will hear from her in at just 30 past the hour. So that's all I've got. So that's the purpose. That's what we're excited about. And I want to just get into, like, if you're here, you probably know about Chamber Mothers, but just to give an overview, what's our theory of change? We know that in order for us to come together and build our base of support and demand what we need to work in three ways. So we advocate at the federal level with the help of our government affairs firm Kroll and Mooring. We work with bipartisan, bicameral, meaning both on the House side and Senate side, members of Congress. We organize. So that's our local chapters. That's what it's all about, coming together and making change in a local and state way. And also,
Erin, I'm
the
gonna
third
stop,
thing.
Erin, I'm gonna stop you for 1
Go
second.
ahead.
We're having issues with the Canva. Can we switch? I'm gonna share my screen instead of whoever is sharing so that we can see the slides. Let's see if this will work.
Perfect. I noticed that they weren't advancing. I was just going.
You might want to use them. They might be helpful for you. Hang on.
Perfect.
I hope you all are not seeing my incredibly messy desktop right now, which just reveals me to absolutely be a person with ADHD. Here we go. Present. Got it.
Just click
Okay.
enter full screen mode if you can.
Hold on. Sorry, guys. I'm not seeing that as an option. Sorry, Deshi. Hold on.
No worries, tech difficulties. That's okay.
Full
This
screen.
happens.
Here we go. Okay. Did that work? How's that?
Here we go. Boom.
Amazing. All
So
right.
go
I'm gonna
ahead, three
advance us.
slides.
Wonderful.
Erin welcomed us. Erin's talking about our
Boom,
theory of
boom.
change.
All right, there we
Go for
are.
it.
I was just at narrative shift. So we're changing the narrative on mothers. We're showing that even when tech goes awry, we're powerful. Okay. We're shifting the narrative on how mothers see themselves and also how this country and the world sees mothers. We are forces and agents of change, and with our political will together, we will make our priorities mainstream priorities. So that's the goal. Those are the three ways in which we work. Next slide is all about our three pillars. So what do we advocate for? When we decided what to advocate for, we looked where can we all agree? We can all agree that we need affordable, accessible, quality childcare. So we know that mothers across the country need safe, accessible, high quality, and well compensated, because we know that childcare providers are so often parents. Childcare for every child ages 0 to 18, while upholding the right of families to choose the childcare structure that works best for them. Paid family leave, the rallying cry that we all came together on. We advocate for a robust national plan that reflects paid leaves, 85% public approval rating, and provides a floor of support to keep families from having to choose between their jobs and their loved ones. Improve maternal health outcomes. So tackling systemic inequities through private and public sector solutions that reduce maternal mortality and bias in care, and make motherhood overall a joy and not a threat. So those are the three pillars that we fight for together. So today we are centering maternal health. And honestly, of our three pillars, maternal health is the center of all of it, right? That's why we are doing all of this work. When you have paid leave, mothers can recover physically and adjust emotionally to this massive discombobulation and joy in all of it, but we need time. When you have childcare, mothers have mental health relief and time to tend to their own medical needs. And it's just a requirement in order to move through your life. So maternal health is where we focused our energy. What's that? Sorry, I heard somebody come in. So maternal health is where we focused our energy in our meetings. We had our power breakfast. It was our second annual. So we came together last year and brought together public and private sector leaders to champion maternal health. We did it again this year because the first time was so successful and it was fantastic the second time around. So Just to give you a little look at what we did there that day, as one of our speakers, Angelina Spicer, said, it was a room full of a lot of moms and a couple of dudes who were all champions of maternal health. So we heard from Representative Lauren Underwood, the co-founder of the Black Maternal Health Caucus and the brilliant mind behind the Momnibus, which is 13 pieces of legislation aimed at improving maternal health across the country. We were also really moved by the words of Representative Brittany Pedersen, who co-sponsored a bill to allow remote voting for members who were home on family leave. And also, just peeking behind the curtain, Rep. Pedersen was running late that morning because her childcare fell apart. And I said to our event planner, please tell her to bring baby Sam. And she did. And baby Sam went up in his doona, and Rep. Pedersen gave her remarks. And it was the most relatable, amazing moment of the day, except for my babies would have screamed through all my remarks. That was the only part that wasn't relatable. Her co-sponsor, Representative Anna Paulina Luna, on the voting proxy, said she had a conflict at the last minute, but I want to name her here. She was confirmed until the very last minute. And I think it's important to show that on both sides of the aisle, Representative Pedersen being a Democrat, Luna a Republican, they came together to work toward the same goal. Moms United are moms who are powerful. We say that all the time, and it is very true. We have got to stick together in this work. We hosted an amazing panel featuring Paid Leave for All's Dawn Hucklebridge, alongside 3 of our board members, OBGYN Dr. Rachel Blake, reproductive psychiatrist Catherine Berndorf, who's also the founder of the Motherhood Center, who I'm sure a lot of you know of, and Capita's childcare expert, and my favorite childcare expert, Elliot Haspel. Then we put on our sneakers and flats. And if you're like me, you just headed out in heels and still have blisters for 2 full days of Hill meetings. So we met with 13 members of Congress. And I want to give you just an overview of what we experienced, because, you know, it's quite an interesting atmosphere. And I think it's important to share with all of you just what we learned. So first and foremost, bipartisan work is the only way forward. We heard this in every office. In Democratic-led offices, we were hearing that they need Republicans to sign on to have any chance of success right now. And actually, Republicans feel the same way. They feel the pressure to work across the aisle because their majority is so slim. And we just have to find where we agree. Number 2, avoiding cuts to Medicaid is a priority across parties, because the way federal funds are allocated to each state, and we learned this is very interesting, it's according to how many people live beneath the poverty level, and many red state representatives are just as worried as the blue ones. Additionally, we advocated against additional eligibility requirements. So there's a movement to have, right now, there's 1 eligibility requirement a year, a move to have 2. We argued against this because you can imagine the most burdened people are single moms who are already clearing red tape. To have them do that again in order to get care is unthinkable. So we were down in the details advocating about Medicaid. Offices are open to creative solutions on childcare. This is my 3rd point. So we heard a lot about how to use the tax code to move our imperatives, paid leave, childcare, and maternal health forward. One really creative solution is using 529 accounts, which are usually set aside for college, for childcare, not just college expenses. Number 4, family values require support for families after a baby is born too. Enough said, but everybody was saying it. This is interesting too. We toss around jargon a lot in the care space, and we talk about maternal care deserts. We found that Congress people across the aisle we're using this phrase, talking about maternal care deserts. What does this mean? Well, 1 in 3 American moms live in a county with no hospital or birthing center. Lawmakers across the political spectrum agree that we are in a maternal health emergency. We need to stay focused on finding bipartisan solutions that are adaptable to the nuanced considerations that vary state by state. So that's what we heard a lot. We would sit in different states, whether it's Arkansas, Alabama, Ohio, New Jersey. They want solutions that are tailored to their states, and they're acknowledging that in many places, there just simply is not the medical care that's needed. Number 6, relevant to all of you specifically, our chapter work is critical. Not only do lawmakers at the federal level need and want to hear from you, their constituents, they have a job because of you, okay? Never forget that. They want to hear your stories, and we bring your stories, and they ask for more of your stories. Then they also loved hearing about the work that you're doing in their home states, because again, remember, they're there to represent you. So they want to hear about it. They want you out there fighting for what you need in their states. And so with that having been said, I want to zoom in on 2 of our 43 chapters and focus in now. To do that, please welcome the person who grows and nurtures these chapters every single day, person very dear to my heart, mom of 1, singer-songwriter, Michigander, and our Chamber Mothers Director of Grassroots Advocacy, Annie Bacon. Take it away.
Thank you so much, Erin. I am going to speak super fast so that our chapters get most of this airtime. As Erin said, we're up to 43 chapters. Our latest is Nashville, which can hopefully be launching over the summer. And then coming soon, we'll have New Orleans and Iowa. If you were in either of these places, reach out to us and we'll connect you. Kelsey's going to drop a list in the chat of some of the things our chapters are up to on a regular basis. And all of this, by the way, is really just in less than 18 months that the chapters have been up and running. It blows my mind. I specifically want to call out our LA chapter, who hosted a virtual statewide workshop on California's maternity leave laws just yesterday. Our Boston chapter, which is part of the statewide Mind the Gap Coalition, just helped get $220,000 for the Moms Matter Act included in the Senate budget. And our Pittsburgh and Philadelphia chapters, who are currently working with the Maternity Care Coalition to advance a statewide paid leave initiative. We also, as Erin said, brought hundreds of chapter stories and your stories with us to DC. It makes such a huge difference. And you're going to hear a little bit more about our Phoenix chapter in a little bit, but I'd love to zoom in on 2 of our chapters, our Cincinnati and Chicago chapters. These are 2 of our longest standing chapters. So I'm going to hand it right over to the chapters to introduce themselves. So excuse me. We're going to first introduce Amanda from our Cincinnati chapter to tell us about Cincinnati. So if you could introduce the chapter, how long you've been in action, and one thing your chapter has been focused on that you're proud of.
Yeah. Hi, everyone. So happy to be here representing Cincinnati with my 2 co-facilitators. Our chapter, we had our first meeting last June. So we're coming up on 1 year old. I think we've had 15 meetings in that time. We've met monthly. And then during the summer when we kicked off, we had a couple 2-for-1 months as we had some introductory meetings. I think what we're most proud of in this first year is just really getting established with membership and creating a space for local moms to channel some of that frustration, some of those big feelings, and their desire to find a community, and they're finding it here. We have over 350 names on our email list. We've had over 100 unique moms come through our different meetings, and they're showing up not just to build community, but to do the work as well and to grow relationships through that. And that's just been amazing to see. So Jody is going to tell us a little bit about some of our work that we're doing with Representative Greg Landsman's office, who represents our District 1 at the federal level.
Great. So actually, Jody, hold 1 second, because we're going to have you each introduce yourselves first. So Emily, if you wouldn't mind, Emily over in Chicago, if you would introduce the Chicago chapter.
Not at all. Hey, I'm Emily Gennaro. I'm from Chicago. Chicago relaunched last April, so we're just over a year old, and relaunching the chapter was my amazing co-facilitator, Nancy, who is on the call, and then Abby, who wasn't able to join us today. So in that last 13 months, we meet monthly. And I would say the things that we are most proud of over the last year are developing partnerships, both at the Chicago level and the state level, specifically focused on maternal health. So we've got a really strong partnership here in Chicago with the PCC Wellness Center that's located, I believe, on the west side of the city. And we're starting up a partnership with EverThrive Illinois, which we're super excited about for ongoing advocacy efforts.
That's amazing. Thank you so much. Okay, so now I want to get into the talking. So really quick, whoever is running the slides, would it be possible to highlight the speakers instead? Because I'd love for you all to get to see each other. So let's go back. As Amanda set up, Jody, you guys have been working with Representative Greg Landsman's office to plan a future child care summit. How did you identify that focus with their office, and how did the idea of the child care summit come around?
Yeah, thanks. So I'm Jody Cunningham, one of the co-facilitators with Amanda. So obviously, as this group knows, childcare and its inaccessibility is clearly tied to maternal health. So very aligned with what we're talking about today. We've heard from a lot of our members, new moms and seasoned moms, that that's a real barrier for them. So we thankfully were connected to Greg Landsman, who we have personal relationships with, but our national team here connected us to Greg to start to meet. And with his team, we've been able to identify that we need to learn more about the childcare issue here in Cincinnati. So it feels like it's this elusive, inaccessible thing and unaffordable. And we hear a lot about that, but we heard from his office loud and clear, like, we need the real data. We need the real stories about what's happening. So those conversations evolved into planning this future childcare summit, which is going to be an opportunity to bring together parents, providers, policymakers, and community partners, centering those lived experiences of caregivers to move towards real solutions. So we're in the planning stages of that summit. It's going to take place sometime this fall. But one thing that's clear is that we want to hear from those parents and caregivers about what's going well, what isn't. And we plan to wrap the summit with roundtable discussions with representatives all across the aisle from to develop solutions for what we want to do next. So as part of that work, we've realized we need better data. Stories, yes, but also those numbers to show where those pressure points are for families and providers in our region. So that's what led to the creation of a childcare survey, which is something we've also been tackling on. So I can pass it to Sarah, our third co-facilitator, to talk a little bit about the survey.
Great. And we're getting Sarah in. There we are. Great. Sarah, so yeah, as part of that work, as Jody said, you created this amazing survey. Like, I'm blown away by it. So tell us a little bit more about the process of creating that survey.
Yeah. So like Jody said, after meeting with Greg Landsman's office, and he's very passionate about early childhood education policy, he realized that there's just a lack of data around particularly ages 0 to 3 childcare. And we just didn't have information on the realities that providers are facing, and just any sort of workable data that could be used to actually like create policy that would really affect change in the Cincinnati area. And so from there, Landsman's office turned it over back to Chamber of Moms. And we as a chapter created survey questions. Collaboratively, we worked and reached out to our network of friends and family who are some survey design experts to just better format this survey. And we pilot tested the survey a couple times now with childcare providers, and it is getting ready to launch in the Cincinnati area on June 1st, I believe. And so with that, we are really excited to have some hopefully salient data points to present at the Child Care Summit, and just have better wrap up information of like what is actually happening on the ground that providers are experiencing, so that we can continue working with Landsman's office to make some policy recommendations and affect change.
That's amazing. Thank you so much for sharing that. And we're going to hand it over to Nancy in Chicago. So there's so many different things that the Chicago chapter is doing that we could focus on, but because you were just at the Power Breakfast, you were the winners of our end of the year fundraising campaign. We would love to know what that experience was like for you and your chapter. Did it give you any new insight into how you'll approach your chapter work in the future?
Yeah, thank you, Annie. It was phenomenal. So one of the biggest takeaways for me was that as chapter facilitators, we are doing incredible work, and I was so inspired meeting so many of my fellow facilitators and just hearing the way that they worked the room and connected with legislators. I was definitely inspired to want to do more and to also skill myself up and make sure, I'm connecting with our own state legislators in a meaningful way. And the power of storytelling is huge too. So for me, knowing that regardless of what side of the aisle that you're on, stories is what really connects us to this work. And so it made me think about and fired up to go back to Chicago, but also beyond Chicago, and think about how do we incorporate the stories of so many mothers, regardless of your perspective, which area of, the state of Illinois that you're from, like how do we ensure that we are collecting diverse stories so that the experience of motherhood is incorporated into the work that we do. So that was a huge takeaway for us as a chapter and something that we're continuing to work on.
I love that. And I do want to call out, because you're talking about skill up leveling, that something, I would just really want to recognize your chapter for is that you have done a ton of civic education with your chapter. And I really admire that. We're kind of out of time for our section because I wanted to dig into that more with you all, but thank you to both of your chapters, and a nod to Abby, who couldn't be with us today, for all of the incredible work. And if you would like to connect with any of our chapters, you can find them through our link in bio on Instagram is actually the best way to connect. We have a chapter hub there. You can also always email me, Annie@chamberofmothers.com, and I can put you directly in touch with your chapter. So thank you so much.
Amazing. Annie, thank you so much for that. And for any of you watching who want to start a local chapter, I'm just going to be really transparent and tell you that we have actually 300 people who've raised their hands to do so, which is extraordinary. We want every single one of you to have a chapter in your neighborhood. And we're trying to open lots more by the end of the year so that we're in all 50 states. We're well on our way. That takes funding, and we need like 3 Annies to do that training. And as we write grant proposals and pitch donors, chapter expansion is priority number 1 for us because of all this amazing work that you're able to get accomplished. And it's where individual donations go to. So we're putting a link in the chat to help support our Moms Helping Moms Mother's Day campaign, and that is exactly where those funds will go. So next, I want to introduce a section of our program that we call Distill the Hill, because I'm a copywriter by training, but actually this time it's more like Elucidate the State, because our special guest is a state representative who's going to give us insight into how she helped pass just last week a maternal health bill in Arizona that could be a model for all of us. So to introduce her and to be in conversation with her, please welcome our head of social and the co-lead of our Phoenix Gilbert chapter, Kelsey Glenn. I'm going to stop sharing, which I've now learned will let Kelsey be seen. There you are. Great.
Yay, awesome. I am so honored to welcome Representative Willoughby to our town hall today. She is the majority whip of the Arizona House of Representatives, representing District 13. So if you're here in District 13, woo, and serves on the Health and Human Services, Appropriations, and Judiciary committees. Before entering politics, she worked as a trauma and emergency nurse and is also a proud mom of 2. This session, she sponsored several bills, including HB 2332, a maternal health bill that our Phoenix Gilbert chapter really rallied behind. We really mobilized, called, emailed, published op-eds, we testified in person, and amplified through national campaigns as well. And we are so thrilled to see the bill signed into law by Arizona Governor Hobbs last week. And my first question for Representative Willoughby, I cried tears of joy. I don't know if you did, but I did when this bill passed. Can you please tell us what the bill specifically covers and also about what you drew to introduce it?
Absolutely. And thank you so much for inviting me here. This is such an honor to be with all of you and to hear everything that's going on and the great work that you're doing. It's absolutely amazing to know that there's people out there that care about specific things and not just care in the way that they talk, but they have action to their talk, and it's just a thrill. So jumping right into what the legislation did. So nearly half of all pregnancy-associated deaths in Arizona are linked to mental health conditions or substance use or disorders. With that, we know that it makes a huge critical gap in our healthcare system. So that is exactly what the bill was trying to do. The bill directs the department here in Arizona to identify and compile clear educational materials on maternal mental health for both healthcare professionals and patients. We know that there are times where moms don't go to their follow-ups with their OB afterwards, but they typically will go to their pediatricians for follow-up with their new babies. So encouraging those health professionals to really engage not just in the pediatric side of it, but identifying the moms while they're there too. This ensures that the women will be equipped with information and support and resources that they need and to recognize, and to provide it not just to the mothers, because a lot of times we know with postpartum, it's not the mothers that identify it, it's typically the family around them that identify and help get them support. When compiling the education materials in this bill, the department must use resources that are developed by organizations that have recognized expertise in maternal mental health, which is a big deal. This isn't just a talking point or a generic CDC kind of handout. This is going to be tailored not only to mothers, but by professionals in our state. Just like something that was mentioned earlier, each state kind of needs something different. So this is not going to just be a blanket national thing. It's going to be very honed into our Arizonans. Additionally, 2332 requires that the department to post this information online as well, so it can be publicly accessed at any given time. Because I mean, when you leave a hospital, you leave with hundreds of papers and information, and it's hard to just keep track of it, but you can always go back and find the information. With that also, one of the big things for me in this bill is that not only is it doing education material, but we're also establishing an advisory committee focused on improving access to OBGYN and maternal mental health services in low volume, high risk rural communities, which we have a ton of here in Arizona. The committee will include diverse healthcare professionals and stakeholders who will develop recommendations to strengthen our maternal care in rural hospitals, expand our postpartum screening and treatments, and addresses barriers such as insurance coverage. So that board and committee is going to have a huge impact on the information. Arizona is ranked very, very low in their care for maternal and postpartum. And I'm really hoping to bring up exactly where our gaps are, so that way we can address with legislation those gaps and fix it moving forward. So it's a bit of a long-term goal to get all that data, but if you have to start somewhere, and I'm super excited. I do want to throw out though that your chapter is just so amazing. There's so much energy behind you guys, and I didn't even realize that you were out there and following the bill until you came and testified in committee. And seeing somebody come and testify, most of the time as a bill sponsor, you'll know who's coming to testify in favor or in opposition of your bill. And seeing somebody that I wasn't on my radar at all come in, it was just such an honor that you guys cared enough to do that. And I can tell you that in the committee, I was like, oh my gosh, I need to meet these people. There's something there. So whatever you're doing is fabulous.
Thank you so much, Representative Willoughby. And thank you for that overview and explanation. As we know, bills can be super complicated and lots of words, but I think that this bill will be so important to Arizona mothers. And we were so excited to rally behind you and this bill. My next question, we know that HB 2332 was a very much a bipartisan effort. You also recently helped fund services for tens of thousands of disabled people in our state. And the press actually made a really big deal of Arizona Governor Katie Hobbs, a Democrat, giving you a Republican. Kudos. At Chamber of Mothers, we are specifically nonpartisan because we know these issues are universal. What have you learned about working across the aisle, and what are the challenges?
It's so interesting because there's so many things that we can work on together. And I don't always remember the political environment being as split as it has been in the last 4 to 8 years. It just got divided, and I'm not sure where it was, but I'm so happy to see that there's an appetite to fix that and rectify that and coming back, because sometimes whenever you say working across the aisle, that used to be a favorable comment or statement. Now it has a negative connotation to it, but I can see with the movement that we've started that this is going to be a positive statement again, that we're working together to come together for the betterment of everybody. This is no longer a me versus you, because I'm not there as me. I'm there as a representative for my entire district and the state. And a lot more individuals are seeing that. They're not liking the bomb throwing, name calling kind of politics that we found ourselves in. And I think overall, we're going to benefit as a nation for that. And these type of movements that are very, very important and vital to our communities and the strength and health of our communities are just going to thrive.
Thank you. So we love that, how much you focused on working across the aisle. So thank you. And I think I'm so sorry, we have to cut you a little short, Representative Willoughby. I'll pass it back over to Lauren. But again, thank you so much for all of your work and impact you've had here in Arizona. As an Arizona mother, I am so grateful for the work you're doing. And I know this bill will really save lives. So thank you.
Thank you.
Yes, thank you, Representative Willoughby, and thank you so much, Kelsey. And next, I'm super excited to multitask here and tell you that our special guest, as you heard up front, is Dr. Becky Kennedy, founder of Good Inside. One of our missions, as Erin mentioned earlier, is to care for you today. And maternal health isn't just some big ephemeral goal. It starts with you feeling good in your body and your mind, even as you're helping your kids' bodies and minds too. It's like origami, layers folded into layers of examples said and deep breaths taken. And here to help with that is an amazing friend of Chamber of Mothers, our special guest today, Dr. Becky Kennedy. Recognized as the Millennial Parenting Whisperer by Time Magazine, is a clinical psychologist, mother of 3, and #1 New York Times bestselling author. She is also the founder of Good Inside, a company with an innovative mobile app that serves as a 24/7 parenting coach. I highly recommend signing up at goodinside.com. And I would love to welcome Dr. Becky. Thank you for being here with us.
Thank you for having me. Thank you
So
for your
we-
work.
Of course, and thank you for listening in too. So we've received a ton of questions from our audience for you. I would love to hear first, why support Chamber of Mothers? How does supporting parenting support maternal health, maternal mental health, just generally? How do you connect the two?
I mean, look, I think we've been sold this really awful story that both affects our kids' mental health and massively affects our mental health. And I think part of it, and I see in the chat people talking about our app, I love that people are using it, and that what other job is this hard and this ongoing? And we are told that tips on Instagram should be able to get us through. Like if I ever saw a surgeon who was like, I didn't go to med school, I get my tips on Instagram, it's all going to work out, I'd be like beelining out of that. And in fact, the doctor we want to see is the one who takes pride in their education. They put it in the wall. And this whole idea that parenting comes naturally, the only thing that comes naturally is how you were parented. Why would anything else come naturally? And so we're learning a new language. We know our relationship with our kid has the biggest impact more than anything else on their mental health going forward. So, and how we are when we become a mom has the biggest impact on our mental health. And then we're told, oh, I watched the reel, it didn't work, or I listened to a podcast. Like at Good Inside, like we are creating a world where parents take pride in education, where they know parenting is a skill. Loving your kid comes naturally, knowing how to deal with a tantrum or a kid lying to your face, or them asking you how babies are really made, all of which have really big impacts on their mental health and ours going forward. That skill. And the good news is we're not behind. We can learn a skill, not on social media, but that's like really what we're excited about. And we see the positive impact then on a mom's mental health, where they actually find their wins and their strength and their confidence in the moments that used to send them spiraling. And we believe we can change that worldwide.
I love that. I love that so much. Thank you. It's really good perspective. So we have 3 questions that came in. We had dozens of questions that came in, but we narrowed it down to just 3 that felt really pretty universal and relatable. The first one, if I can just hit you with it, is whining is so triggering for me. And this is not from me, but it is indeed also triggering for me. Whining is so triggering for me. How do I manage my own emotions and mental well-being around these moments?
Yes. So first of all, kudos to this parent for being able to say blank is so triggering to me. Like the program I want to do with people when they're pregnant is knowing what will be my triggers, because they're never mysteries. Okay. Because we all have them. It's not like the best parent is when it's like, I'm not triggered by anything. That parent's a liar. We don't like people like that. Everyone has triggers. Okay. So our triggers really with our kids are things that we had to shut down when we were kids. Okay, now we have to get a little bit more nuanced than just the behavior. Okay, so let's say whining triggers me. Parents will say to me, so Dr. Becky, you're saying some parents like whining? No, no parents like whining. But being able to deal with whining versus yelling things we don't want to yell at our kids when they're whining is a big difference. Whining often represents helplessness. Think about when we whine. I once showed up at a coffee shop. I needed my coffee before my meeting. They were unexpectedly closed. I whined the heck out of that situation. I was like, please open the door. Why? I wanted something so bad and I felt helpless. Okay. Think about your own childhood. If you grew up in a pull up your bootstraps, stop crying, or I'll give you something to cry about. This is not a big deal. Pull it together, family. Then what you had to learn adaptively, thank goodness we learned this, is if I feel helpless, I better shut that down. I'm going to actually talk to myself in an awful way. So at least that part of me doesn't get like the injury of then being further shut down by my parent. That's adaptive. Fast forward 30 years, my kid is whining. Oh, and it's always something silly like, I can't find the garbage can. And you're like, you're next to the garbage can. Right. But whatever they're saying is really, I feel helpless. Our body scans what we know. What do I know about helplessness? We think we're talking to our kid when we're triggered. No, we are talking to the child part of ourselves, even though it's now 2025. And when we start to realize we're triggered by something in our kid that we had to shut down in ourselves, we realize the work happens in here, not out there. And so anyone who wants to learn more about triggers, it's probably one of my favorite things on our app. It's easy to find if you're already there. It's just called the Triggers program, right? I actually think sometimes with our kids, we look to solve our kids' struggles to a strategy with them. The much more empowering work is learning how to better understand ourselves, cope, and then the other stuff comes a lot more easily with them.
I just want to say thank you for that, because I feel like you taught me something about talking to myself and what triggers me, but also there's insight there, and I wonder if others feel this about my partner and about what triggers him too. So thank you for that. Okay, next question, and actually this gets right back to the generational stuff. So it's understandable, of course, that health norms change generation to generation, but how can I handle unwanted comments or worries from the grandparents about things like how much weight I've gained during pregnancy, or being on an SSRI while I'm breastfeeding, or using gentle parenting with my toddler?
Yeah. So I think, again, like what I like to do with our questions is like, what are we really talking about here? Right. And I think what we're really talking about is what is it like for me to start to figure out my values and what I want in the face of pushback or questioning, and I'll tell you what I mean by that, from people I've traditionally really cared about for approval. Right? The only reason any of that bothers us, by the way, it's annoying, but the only reason it really bothers us in a deep way is on some level, we still are looking for our parents to say, you're making the right decision. I remember the time as an adult, I was like, oh my goodness, why didn't anyone tell me I don't need my parents' approval anymore? And I feel like someone should tell you this. It was like amazing. I mean, it's not like that then it got easy, but I was like, that's actually what it means to be an adult. Right. And so when I realized, okay, the SSRI that I believe I need to take, it really triggers me that my parents questioning again. Probably the answer is more me looking in the mirror or doing some deeper work, is just how can I have conviction in my decisions in the face of my parent not agreeing? That's just like a life question for ourselves, right? How can I have conviction in my parenting approach without my parents saying, this is the right decision? Because as soon as I do, those comments become annoying, but they become more like flies annoying instead of like a stinger that goes right to our heart. Right. And so I think, again, our problems become solved often not when we have the right answers. I don't have answers for anything, but I actually think our problems become solved more easily when we just start asking ourselves the right questions, even if we never fully answer them. And I think that's kind of where I would go there. Very, very practically, everyone knows I love to take deep ideas and make them practical. Words we can say to our parents, I think, help when you're like, I want to let my parent know. They're probably asking, or saying something from a good intention place. And I'm going to establish my own boundaries. Hey, I know I'm parenting and doing things different than you did with me. Let me say right from the bat, the way I parent is not a way of giving you a report card of how you parented me. I actually believe we're both doing the same thing. We are both doing the best we can with the resources we have available. We are both just trying to figure this thing out. And so I want you to know that this is not about blame. This is not about criticism. And I would love if you could look at my decisions through that light. I think we could just probably have different conversations. And I think that is what happens for grandparents. They're kind of like, I need you to punish your kid so I feel less guilty about punishing you, or whatever it was. And we were like, this is not really about you. Actually, then they can enter a little bit more as a teammate.
That's really, really helpful too. Okay, last question. I try hard to make things special for my kids, whether it's creating little traditions, celebrating who they are, or turning ordinary days into something magical. But often it's met with meltdowns, resistance, or indifference. And as a mom of a teenager, that part I relate to, the indifference.
Yeah.
I know it's age appropriate behavior, but it still stings. How can I build more emotional resilience as a parent and not take it so personally when my efforts aren't appreciated? And how do I stay motivated to keep showing up with intention, even when sometimes it feels thankless?
Yeah. So funny. I literally today was recording a podcast about the summer. It'll come out about the different roles we take on in the summer and how we end up resenting them all. And one of them is like magic memory maker. And you're like, make magical memories in the summer. And most of us
Picnics,
are
all
trying to
picnics,
make
all the
it
time.
till bedtime. Okay. I'm just trying to make it till bedtime. Okay. I'm not trying to make the magic. So there's a couple things there. And I actually think hopefully with everything we do at Good Inside, there's always themes, which is good. It's like we always are like learn 4 or 5 things and apply it everywhere. It's much better than like learn a million different things for everything. To some degree, I think what this mom is saying is I look to my kid's reaction as a barometer of whether I'm doing the right thing. That is not a good situation ever. I don't want to look to my parents to see if I'm making a right decision. And if I really want to, I don't know, make a homemade cake and do the funfetti, like I have to say to myself, Becky, do I want that? Or am I doing that because I think my kid wants that, or that's what they need to feel connected to me? And a lot of times it's because like that's not even what my kid wants, right? I think we have to separate like magic from like the really simple, ordinary things our kids want. And they're never going to say it. Like my kids, people think my kids have never been like, Mom, I just want you to be present with me. No, they're like normal children. No one says that. Okay. But that's what kids want. They want us to come in without an agenda. So sometimes our magic making energy feels so agenda heavy that they're like a pawn in our game, and they kind of are sometimes. We're like, you're supposed to smile and tell me I'm an amazing mom, and then we're going to have a great day, right? And they're like, no, thank you, right? And so they feel that, and you feel that from someone in a relationship. You feel if your partner takes you out for your birthday, you're like, okay, so I'm just supposed to say thank you and amazing job. Like, this isn't even about me. This is about you feeling good about yourself as my partner on my birthday. Like, I feel that, right? Where this doesn't mean we should do nothing, because my partner did nothing on my birthday. I wouldn't be happy about that either. But there is something in between. And I do think if this is a dynamic, naming this to your kid is powerful. Lauren, I don't know, like, especially a teen, I find the phrase, does it ever feel like, and I'll show you what I mean, without trying to fix it, is the best thing. Does it ever feel like whenever we're together, I'm just like trying to make these magic moments and you just find it more annoying than helpful? And your kid will look at you and give you actually the win. They go, yeah, okay. And then you don't have to fix it. I think you just have to say, oh, yeah, I do that. Again, like imagine your boss being like, does it ever feel like I just cut you off at meetings and don't let you get a word in? And you're like, yeah. And you're like, immediately leave the office. You're like, I love my boss. They didn't even change anything. They didn't even promise to change anything. And so just name it. And then you can ask your kid, I don't know, is there a version of it would feel better? They might be like, yeah, don't get 30 toppings for the cupcakes. Like, I don't really care. Or they might just want you to watch them play a video game and enter their world without an agenda instead of creating a magic world where nobody really lives in a magic world anyway. And so, yes, this is a long-winded way of saying less is more. Especially in this day and age of like, oh, there's so much to do and there's so much to consume. Like the things I think we all crave. Like my best nights is like I just had coffee or whatever, dinner with a friend, and it just felt like old school and we were laughing and that's it. Right. And there was no agenda. There was no like, let's go to the best restaurant. It was just like, hey, do you want to meet here? Great. And so I hope that's permission to like, oh, okay, maybe that's actually simpler. And it might be better for everyone.
I feel like you're giving me permission to say that like sitting on the couch and having a glass of water, like those two things can actually be enough sometimes, right?
Without a doubt, especially in your kids' world, the world our kids live in is so busy. It's so hectic. There's so much to do. There's so much performance. Like the idea that your special time can just be like those extra 8 minutes when they finally want to talk to you, even though you like really do want the night to be over. Like, okay, those are the best. Those are the magic. Like I get everything from my kids in the 8 minutes. That part of me says, I just want to finish bedtime, but the other part of me is like, this is the magic and means I don't have to plan the special event. So this is actually winning for everyone.
It's the little in-between moments. Well, thank you. This was such a gift to all of us. And, you know, as we said earlier, there's so much of what we do is about community action and making a difference and banding together. And like our community members sometimes just need to receive something back. So thank you for caring for all of us. We really appreciate it.
You do such important work. Everyone here, I just hope you say to yourself, like you carved out time for this. You could have been like watching Netflix, which by the way, I love watching
Also
Netflix,
fine.
but, like,
Also fine.
you're ahead of the game. You're ahead of the game. So often, like, I didn't do this. You're doing so much. This group of amazing people, just like, I'm gonna give you that, but I hope you give yourself that because it's so true. So thank you, Lauren.
Thank
Thank you
you.
for having me.
Thank you so, so much. And I will popcorn it right back to Erin.
Dr. Becky, thank you for being here. Also, I'm a fellow Dookie, so I've been a big fan of yours for a long time. And I also took a ton of notes. You were speaking right to all of our hearts. So thank you for being here. This was incredibly nourishing. Thank you so much. And now with us all filled up and like, we're at the point in our program where we take this energy and we turn it into action. We have 2 actions tied to the takeaways that I mentioned earlier from our last trip to DC. Okay, so for the first one, we'd like you to click a link in the chat. There should be a link in the chat. Everybody see it? There we go. Sweet. Nice work, Kelsey. Okay, so all right, you heard me mention that 1 out of 3 moms live in what's designated as a maternal care desert. We want to know how many of you have had that experience, but we also want to hear from the not quite desert you might live in, the barriers that keep you from accessing the quality of care that you need. Please take a couple minutes and a breath to answer the survey. It's anonymous, and we'll use the resulting stats in social and on our government meetings. And I think Lauren has a special announcement while you
I do.
complete.
It's going to give it a beat. Yes. Okay. So I'm very excited to tell you all that while you're answering that survey, so we believe in surprise and delight here at Chamber of Mothers because moms don't get enough just delight handed to them. So we have a couple of things. As we're doing these 2 actions today, we're going to pepper through a couple of surprise and delights for you. The first one comes from our wonderful board member, Stephanie Roberson, who happens to be the Chief Marketing Officer for ShopBop, and she has a little something for you. I'm going to advance the slides so you get a peek, and then I would love to welcome Stephanie to tell you what she's got for you.
Hi, everyone. I'm Stephanie Roberson, and I'm so proud to work alongside all of you. I came to this work for really incredibly personal reasons. I'm a mom of 2. My youngest was born at 25 weeks. And since I've joined ShopBop in 2013, it's really been my mission to drive and support initiatives that reflect the causes that matter to our diverse customers. And I'm grateful to work for an organization that empowers me as a leader. I'm really pleased to offer everyone on this call 20% off their first full price order using code ShopUp20 COM through July 1st of this year. Just in case you didn't get exactly what you wanted for Mother's Day, here's your second chance to pick out something just for yourself. Kelsey is going to drop in the link for our terms page in the chat, and thank you.
Amazing. Thank you. All right, I'm going to share that page again so you all can see the link. Here we go.
Thank you so much, Stephanie. We're so lucky to have you. You're a gift in every way, and your fashion sense is without parallel. And thank you for everybody who took time to answer the survey. Now our last action, super important, super timely. Medicaid's on everybody's mind. We've been told that at this exact moment, yes, there's drama and it's real, with Congress and negotiations as they attempt to hold a vote on the budget right now, which threatens the existence of the Department of Education, food stamps, and so many other things that keep families healthy and even just existing. Calls, so phone calls. I can't see it because of the background, but phone calls, these are the most important thing, more important than emails, anything else you can do. We've been told by our government affairs team, disrupt their day, call them. So that's what we want you to do. You are going to go into the link in the chat where you can find your representative. You can also find it on the QR code on the next slide, the slide that's on there now. And to make it easier, we also have a script for you. Here is that script. So go ahead and give them a call. So I'm going to go on mute because
Erin's meeting because she's calling. I'm going to do the same. I don't know if you guys can see my phone. That's my dog. That's Penny. I'm going to scan the QR code here. Takes me to a site where I put in my zip code. I'm going to get my representative's phone number. I'm going to call it. If you get voicemail, leave a voicemail. That counts. And use this script or one of your choosing.
And confirming that we're calling our representatives and not our senators.
Either is fine. It's in Congress right now, but it'll go to the Senate next.
Okay, great. Thanks. Yes, that's a great call out. If you get the voicemail, please share your zip code on the voicemail so that way they know exactly where you're calling from. And also just a moment for those of you that are listening. It's a very small world out there, and Stephanie Roberson's neonatologist was actually my sister-in-law. So it's funny how things come full circle, but we're all here for a reason, and we're all here to make this country a better place for moms. So I hope you're making that call right now.
All right, I know some of you are probably leaving voicemails or talking to someone right now or waiting to be connected because actually we're flooding their lines. But I want to let you know also that if you call, drop into the chat, I called, and Kelsey is going to be going through, and we have our second surprise and delight for you, which I want to leave the script up for you. So we'll get to the next pretty picture in a minute, but we're going to show you a preview of all of our brand new merch that just got designed with our, I don't know if you noticed, but we have a new sort of brand look, and we've already got a whole batch of really cute t-shirts, and we're going to give away 3 of them. So please pop into the chat if you called, just say, I called, I contacted, I left a voicemail, and Kelsey is going to go through and randomly choose 3 of those names. So Kelsey, do you see one you can call out first?
Yes, I've actually finally got through to my congressperson, by the way. I kept leaving voicemails.
Well done.
So, yes. Okay. Randomly picking Christina G.
Amazing.
Okay. I'm picking 2 more, right?
Yeah. Congrats, Christina G. So if Kelsey calls your name, DM her or just maybe message the hosts and panelists we should have your email, but just your mailing address so that we can get you your shirt and your size.
Yeah, thank you. All right. Next up is Lindsay Garner. Lindsay Garner. Awesome.
Lindsay Garner, congrats.
Yeah.
And how about a third person here? I'll forward so you guys can see it, and then I'll go back to the script in a sec.
Okay.
Sorry for the sirens of New York in the background. Oh, look, there's Kelsey herself.
Yay. And then Carmen Stramara. Probably saying your last name wrong. I'm so sorry. So
amazing. Congratulations to all 3 of you. Here's the script for anybody who needs it for another minute. And Kelsey is also, multitasking queen, going to put the link if you want to buy the new merch. So the t-shirts are available. Everything else that you see up there on the left will be coming really soon in the next couple of weeks. But the t-shirts are dropped. So feel free to buy one if you'd like. She's also going to put a link in again to donate if you'd like to donate to the work that we're doing. And I'm going to send it over to Erin to wrap us up.
First of all, nice work, everybody, staying on time. I'm very impressed. Thank you all for being here. We know you're so busy. It is Maycember. It is a wild time, and look at you being here. We're going to pop the link to buy merch in and the donation link We are largely volunteer. And when I say largely, we are a volunteer organization. And the gifts that you send go toward helping us chapters, to shoring up our chapters with all the resources that they need, do digital education, and go back to these over and over and over and make your stories and your needs known. So thank you for participating. Thank you for donating. Thank you for being a part of this movement. This is your movement. It's your.
Thank you all again. I'm also just peeking at the responses. I love surveys. We've already got almost 100 responses to that survey. So we're going to use that data in our meetings and on our socials. So look for it soon. Thank you for being here. Save the date for August 12th for our next town hall, the third one of the year. Our focus then will be on all mothers' work. So please come see your economic impact, whether that is in the home, in the workplace. You are all in the workforce to us. See you soon.